Right, this is an article that came out in the Newburgh Gazette, and it's dated August 8th, 2017. Opioid crisis far worse in Pennsylvania, new study says. In fact, it's far worse all over the country, according to a lot of the reports that I'm reading. Many states underreport their mortality rates from opioid-related overdose during the early years of the national heroin and painkiller overdose plague, according to a new study. Well, then that is a problem. Why are your coroner offices and your medical examiners allowed to get away with underreporting a crisis? That's a problem. How do you get funding if they are not giving the most accurate numbers for each state? Just saying. Deaths from drug overdoses rose sharply in the first 9 months of 2016. The government reported Tuesday releasing data that confirms the widely held belief that the opioid plague worsened previous year despite step-up efforts by public health authorities. On the left, you see the maps for the official 2014 death rates for all opioid and just heroin. Room. Terrible arithmetic emerged just days after the Presidential Opioid Commission, led by New Jersey Governor Chris Christie, urged Donald Trump to declare a national emergency to deal with the plague. The number of heroin overdoses was 22% higher than reported. The poor data could also make it difficult to identify common characteristics among the worse off states, which in turn make it harder to address the root cause of drug addiction and overdose to avoid future familiar crises. And the Philadelphia division of the U.S. Drug Enforcement Agency for several years has been conducting an analysis of Pennsylvania overdose deaths based on information collected from county coroners across the state. The undercounting occurred because death certificates for Pennsylvania overdose victims often didn't list the specific drugs responsible for the overdose. It didn't identify more total drug overdose deaths than previously estimated for 2014, which totaled more than 47,000. So really the number they reported would be really an undercount if nobody reported it accurately. The study projected that Pennsylvania death rate from heroin was 8.1 per 100,000 people in 2014, far greater than the 3.9 per 100,000 figure previously reported by the federal government. Most New England states generally reported accurate rates. The results were less apparent when using reported rates because high mortality in states such as Pennsylvania were concealed by a frequent lack of specificity about the involved on the death certificate. So it's no telling how many states are doing this if that's the case. So the number actually could be almost double what they actually reported if all of these coroner offices and medical examiner offices are not putting out recording the accurate cause of death, which is, your drug overdose. Not every family member wants the public to know what drugs were all found in the deceased. Okay, well, if you're going to conceal that, then how do you ever get to an accurate count? Okay, well, we saw that in Carrie Fisher's death. She had all them drugs in her system, but it was not listed as a drug death, so it's very convenient for these people to do that. for drug overdose specifically attributed exclusively to heroin, Pennsylvania had a report rate of just under 4 deaths per 100,000 residents. A crucial step to develop policy to combat the fatal drug plague is to have a clear understanding of geographic differences in heroin and opioid-related mortality rates. Christopher J. Roon of the Frank Batten School of Leadership and Public Policy at the University of Virginia said in a press release. Okay, Ohio also has the nation's highest rate of fatality heroin overdose with 10.4 per 100,000. But even there's Roon concluded that death rate for opioids should have been at least 30.3 per 100,000 in 2014 instead of 29.9. See, ladies and gentlemen, I say you take the death rate numbers that's being reported and double it. That's probably more accurate than what we're getting. So it tells me a lot of these coroner offices and medical examiner offices are being very dishonest when they list the cause of death. You know, even if the family don't want it on there, it should still be some kind of way you can report to the state the real cause of death. The underreporting had significant impacts on states' national rankings for their fatal overdose rates. And the overdose death rates are highest for people ages 25 to 64 in the Rust Belt, in Appalachia, and some Western states. You know what? You know what they should do? If they don't report accurate numbers, don't give them the funding to combat this drug plague. You know, that should be a requirement. You have to list the correct cause of death. And, you know, and I'm starting to believe the reason why so many of it's going underreported is because the family is probably requesting it. And these medical offices are just doing what the family requests by not putting it on there and listing another cause of death. Like in Carrie Fisher's case, you know, she had all those drugs in her system, ecstasy, heroin, and all that crap, but they listed sleep apnea as her cause of death. So when they do the count for 2017, she won't even be counted as a drug death, although she had all those drugs in her system. So I now see how y'all play the game. You know, family said they don't want it on there, so you don't count it. That shouldn't be allowed. I mean, that shouldn't be allowed. It should be an accurate count and the accurate cause of death. If you're not going to do that, then, you know, then your whole system is no good. It's just like every other lying system that's in place in America. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.